All right, let's jump right into this explainer and head straight into the fascinating, incredibly high-stakes world of the neonatal intensive care unit, or the NICU. If you walked into one of these modern wards right now, you'd immediately hear the soft hum of monitors, incubators, and ventilators just working around the clock. It's this intensely advanced environment purely dedicated to sustaining life. But right in the middle of all this life-saving tech, there's this wild biological puzzle we need to talk about. We're looking at a scenario where a life-saving element, literally one of the most basic necessities for human survival, can actually become a profound, hidden danger for these vulnerable patients. Today, we're unpacking what's known as the oxygen paradox, specifically looking at a severe condition called retinopathy of prematurity.
So we all naturally think of oxygen as unequivocally good, right? I mean, especially for a tiny, struggling premature infant hooked up to a ventilator, getting that oxygen is absolutely vital therapy. It saves their life. But here's the startling medical paradox. Premature babies are extremely, and I mean extremely, sensitive to oxygen fluctuations. Give them too much, and this life-saving gas flips into a tissue-damaging hazard. It actively generates these things called free radicals, and those completely overwhelm and severely damage the infant's delicate, immature tissues, simply because they don't have the natural defenses built up yet.
Moving right along to Section 1, defining ROP and the threat to developing eyes.
So what exactly is happening here? Well, those free radicals we just talked about, they don't just randomly attack anywhere. They pose a massive, targeted threat to the infant's retina, leading to retinopathy of prematurity, or ROP for short. Basically, this is a disease of abnormal retinal blood vessel development in premature infants, and it can lead to retinal scarring, detachment, and ultimately total blindness. Think about what that really means for a second. ROP isn't some outside bug or infection the baby caught. Not at all. It's a structural failure where the cure, the very oxygen required to keep the baby's lungs and brain functioning, actually disrupts the normal natural growth of blood vessels in the eye. It's literally a devastating cascade triggered by the exact intervention meant to save them.
Section 2. Identifying the at-risk. Who exactly is most vulnerable? Because, not every single infant in the intensive care unit is going to face this specific threat. If you're a doctor staring at a ward full of incubators, how do you pinpoint the highest risk patients so you can allocate your monitoring resources effectively? You've got to be incredibly precise in identifying the exact profile of these vulnerable infants.
And it really comes down to compounding factors that create extreme physiological fragility. Doctors are keeping a super close eye on babies with very low birth weight and those born at less than 32 weeks gestation. That means they were born significantly before their bodies were truly ready for the outside world. Then you add prolonged oxygen therapy to the mix, meaning they've needed that life-saving but hazardous oxygen for extended stretches of time. Finally, you layer on other severe medical complications, things like respiratory distress syndrome, infections like sepsis, or just generally unstable oxygen levels. When you combine all of that together, you're looking at the ultimate high-risk patient for developing ROP.
All right, Section 3, the retinal chain reaction, or the biology of blindness. It's kind of like a delicate Goldilocks situation in there, because the blood vessels are still actively developing. Hitting them with excess oxygen initially suppresses their normal growth. It just halts construction. That halt renders the retina ischemic. Now, ischemic basically just means it's starved of blood flow. Starved of that flow, the tissue goes into a panic and sends out a desperate SOS by releasing a chemical signal called VEGF. This SOS triggers a massive panicked response, causing new, incredibly fragile blood vessels to rapidly and abnormally sprout up.
And if this chain reaction isn't caught and stopped by the medical team, the danger escalates dramatically. Because these newly formed vessels are so rushed and abnormal, they are super weak. They break. And that leads us to 3 terrifying progressive stages. First, bleeding within the eye, which then leads to heavy scarring. Finally, as that scar tissue contracts and shrinks over time, it physically pulls on the retina, eventually detaching it completely from the back of the eye. Retinal detachment is what causes permanent blindness. It's this tragic mechanical failure that all stems from that initial biological panic.
Section 4. Saving infant sight and the NICU protocol.
Thankfully, modern medicine doesn't just leave this up to fate, not even close. Neonatologists and pediatric eye specialists have built a wildly strict, proactive protocol to intercept this chain reaction way before it ever gets to the point of detachment. The absolute primary defense against ROP? Vigilance. By meticulously monitoring those oxygen fluctuations in the incubators minute by minute, doctors try to prevent that initial excess oxygen trigger from even happening.
But beyond that, they mandate early, regular retinal screenings for every single premature infant that fits that high-risk profile we talked about. Doctors literally look right into the baby's eyes to track the development of those vessels. By catching it early, they spot those fragile new vessels before the bleeding and scarring even start, stepping in to save the infant's vision.
So, the big thing you should take away from this explainer is perfectly summed up right here in this powerful equation. Careful oxygen control plus early screening equals the prevention of blindness from ROP. It completely showcases this incredible tightrope walk neonatologists have to maintain every single day. They are actively using a dangerous tool to save a life while simultaneously managing the harm that exact tool can cause. It is a huge testament to the absolute dedication of NICU teams everywhere. And honestly, it really leaves you wondering, what other astonishing medical paradoxes are quietly being managed and solved in intensive care units every single day?